What is infection control? Have you ever wondered how athletes stay safe from infections while competing? Infection control is the answer. It involves a series of practices aimed at preventing the spread of infections in various environments, including sports. Understanding how germs spread is essential for everyone involved in athletics, from trainers to athletes themselves. Germs are tiny organisms that can be found all around us. While many germs are harmless, some can cause infections if they enter the body and multiply. Infections happen when the body's immune system cannot effectively fight off these germs. Factors like underlying medical conditions or treatments that weaken the immune system can increase the risk of infections. In the world of sports, infection control is especially important. Athletes often come into close contact with one another, and injuries can expose them to blood-borne pathogens. So, how do athletic trainers ensure a safe environment? First, hand hygiene is a must. Frequent hand washing helps prevent the spread of germs. Athletic trainers should wash their hands often, especially after treating wounds or coming into contact with bodily fluids. Next, wearing protective equipment is key. Gloves and other protective clothing can help trainers avoid direct contact with potentially infectious materials. This is vital when handling injuries or cleaning equipment. Another important aspect is following universal precautions. This means treating all bodily fluids as if they are infectious. For instance, trainers should wear gloves when dealing with blood or other fluids and ensure that any athlete with an open wound is treated properly before returning to play. Cleaning and disinfecting surfaces and equipment regularly can also reduce the risk of infection. Trainers should use appropriate disinfectants on surfaces that may have come into contact with bodily fluids. Staying up to date with vaccinations is another way to prevent the spread of infectious diseases among athletes and staff. Immunizations can protect everyone involved in sports from various illnesses. There are also specialized measures known as transmission-based precautions. These are extra steps taken when dealing with specific infectious agents that spread through contact, droplets, or airborne routes. In sports, this might involve isolating athletes with contagious illnesses or using masks to prevent airborne transmission. Blood-borne pathogens are infectious microorganisms found in human blood that can cause disease. When handling blood or bodily fluids, strict adherence to infection control protocols is necessary to prevent exposure. For those pursuing careers in athletic training, understanding and implementing infection control practices is vital. It helps maintain a safe and healthy environment for athletes. Following established guidelines and staying updated on the latest strategies is essential to address emerging health challenges in sports. Infection control is not just a set of rules. It is a commitment to the safety and well-being of everyone involved in sports. By prioritizing these practices, athletic trainers play a significant role in protecting athletes and ensuring that they can perform at their best.